You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey, Vet Rehabbers, it's Dr. Megan Kelly here, and you're listening to the Veterinary Rehabilitation Podcast. I've got Lisa Mason back on the podcast. I chatted to her in episode 72 in a Behind the Vet Rehab Practice, and after chatting to her, I thought we have to get her on again just to chat about the business behind vet rehab, because Lisa is somebody who is really just succeeding in every way. She's had goals that she's had 5-year goals, and she's exceeded them. So her practice is just growing from strength to strength. So awesome to have you back, Lisa. Thanks so much for joining me.
Thanks for having me.
Lisa, you have a practice called the Florida Veterinary Rehabilitation Practice. And how long have you been in practice again? I know that I asked you this, but just for the people that are listening for the first time now. So how long have you been in practice for?
So I've been in my regular standalone practice right now for a year and a half. And I've been practicing veterinary medicine with rehab mixed in there for the last 8 years now.
So, Lisa, we're going to chat today about the all-important Vet Rehab Team. So this is something that I'm so passionate about, because, there are a lot of vet rehabbers that are standalone and they try and do everything on their own. And I must say, in my practice, I had a vet rehab team. So I realized there were certain things that I was good at, but I needed all those other therapists to help me, whether it be a hydrotherapist, whether it be a physiotherapist. They're skills that every single one of us have. And if we put all those together, our outcomes are so much better when I was just treating them on my own. So let's chat about who are the essential sort of components and who comes together to make up that vet rehab team.
Right. Well, I think to start with, if we're talking just a standalone rehab clinic, I think it's important that there is a veterinarian involved. I think it's just in the difference between physical therapy in human patients versus in the canine patient. They're not coming with all of the diagnostics. The ideal, they come in with a diagnosis, with backing with an MRI behind that. We don't get that in veterinary medicine. We're getting a questionable, is it a cruciate tear? Is it a IVDD? So we need a veterinarian that can give that diagnosis, do the appropriate pain management skills, and then start working on the rehab plan. So I do think of vet physio is a very important part, especially in a standalone rehabilitation facility. And then beyond that, you need somebody that's going to be educated as a rehab nurse, as a rehab assistant, that is going to have that formal training, that knows how to implement the rehab plan. So the treadmill plan, the land exercise plan, the laser, the shockwave, all of the additional things that we potentially are going to be doing with our patients. We need to have people who are going to be intelligent enough to be able to do and perform those, but they don't take us away from seeing those initial patients. The other people you're going to need are going to be, people that are going to help you with billing, that are going to help you with reception, that are also going to help you with cleaning, because sometimes we find ourselves cleaning late in the evening or trying to, settle up any of the notes and things. So we need people that are going to be able to assist us in that. And if we have those people that are, assisting us, we can see more patients. And the goal is to see as many pets and to help as many pets as possible with a good quality of medicine. But if you find yourself doing all of these things in the, that are required of these patients, then you're going to be overwhelmed. You're going to only be able to see, say, 5 patients a day rather than being able to see 15 patients a day. So I think that's where, especially when rehab needs to be really in a standalone facility rather than underneath another vet clinic, in my opinion, you've got to be able to have a whole team that's focused only on the rehab pieces. And then there's someone else that's doing the non-essential things like the billing and the appointments and things like that.
So let's chat a little bit about your team. So who do you have in your team?
So I have myself as the only veterinarian, and I am trained in physical therapy as well as in acupuncture. Then I have a certified canine rehabilitation assistant, and he performs pretty much all of my treatments in the treadmill as well as in the specific exercises. He's also a human chiropractor, so he does do the chiropractic work for us as well. And then we have our assistants, and those assistants are going to be less qualified. Those are the ones that they know how to perform laser. They know how to hold patients for acupuncture. They can, help with the small things. And so she's the girl that helps me with those, holding the patients. And then I have my other assistant who is also well versed in that, but she's also really great at note taking for me. So she's my scribe, and she is able to take an appropriate subjective from my clients, and then she's able to also take notes while I'm working on the patients and grab me things that I need. So that's very helpful there. And then I have a receptionist who does the phone calls, the checking out, the appointments, things like that. My schedule is really challenging because I do work multiple rooms at one time. And so sometimes that takes just somebody that's very good at creative thinking. And then I have my hospital administrator, which is my newest addition, because I was finding myself in rooms all the time, not able to really follow up with what our staff was doing, to keep them on task, to be able to manage conflicts among the team, and to be able to work if there's a disgruntled client that's having a problem. I can't pull myself out of a room away from the patient I'm working on at that time to deal with those things. So I think having an administrator, having someone who can oversee those things is very important as well. And then I do have a massage therapist that helps me out too, to do some of the soft tissue work as well. Trying to delegate some of those things that I don't necessarily have to do all the time, so that my job is to be able to get those diagnoses, to get the medications, to work on pain management for a lot of these clients, because that has to come from me.
Yeah, so I mean, you've got lots and lots of members of your team, but it obviously didn't start off that way. And this is the thing, is that I think a lot of vet rehabbers are in this position where they're just wearing all the hats and they're juggling all the balls, And you talk about your hospital administrator or practice manager, if you think about how many hours we are actually spending in a consult room, there's not a lot of time afterwards to be able to do all the administration. And I think what tends to happen is that we do what we do best, and then so we are great at treating the patients and hopefully doing our notes and anything related to the patients, and then that other stuff just sort of either falls by the wayside, and we never get to it. So like things like marketing, for example, if you are doing the finances, the operations, dealing with clients, everything, invoicing, checking the bank statements, getting all the stuff ready for the accountants, there's just no time. And so
it's overwhelming.
And so there's certain things like marketing is so important, but a lot of vet rehabbers don't have time to do it, so they don't. They don't do it, and also often they don't know how to. They don't know where to start. It's just so overwhelming. Social media, all these different things that you can do, and so when you have somebody to be able to pull it all together, it's such a help, because then you can really just focus on what you're good at. And I think that's what most people want to do. Like I was at a conference maybe about 6 months ago, and it was a business conference, and I met one of my colleagues that I qualified as a vet with, and they've got a veterinary practice. And I said to her, how are things going? And she said, I just wish I could be a vet. That's all I want to do. I just want to be a vet. So the managing and all that kind of stuff is difficult, but so what I want to say is that, like, you obviously get to that point, but let's say you just started, and you are juggling all the balls. So when and how do you make that decision to be able to say, like, now I need to get another team member? Because often we're so worried, like we think like we're barely paying the bills and paying ourselves enough, but we're busy, all right? We are flat out. We are consulting as much as we can on top of all the other things that we're doing. So working long hours, but we're at that point where we haven't, because in order to be able to grow, we actually need more people. So let's chat about what we do to get to that next step.
Sure. Yeah. And I think that's a really, really hard question to answer, because whenever you're really in it, you're like, can I really afford this other person? How much are they going to cost me? Especially hiring an administrator. I mean, you're not talking about just hiring a little hourly employee. That's a big salary that you've got to add in. But it really comes into play where you say, how exhausted am I at the end of the day? Can I keep functioning like this? And in fact, my hospital administrator right now has actually looked at me and she goes, how did you do this before I came in? And I was like, honestly, I don't even know, because it was a lot. And I said, now you're allowing me to practice medicine a little bit better. So I think it's going to be a personal decision. It's going to be a point where you're like, I can't grow anymore. I physically cannot see any more patients anymore, but yet you have the calls coming in wanting to see you. I think that's going to be where some people's trigger is going to be. It's, can I see more? No, I can't, because I've got to have time to do business. I've got to have time for my family. I've got to have time for my own pets. I have got to have time for my own life. And if you find yourself struggling to the point where you're like, I don't have time for anything else, you need to start looking at hiring someone that can help, even with the small things. And the way I like to say is, like, even putting a list together. Like you said, you are a type A personality. I've got lists inside my brain after lists inside my brain, trying to organize them. And I look at that list and I'm like, what on this list do I not necessarily need to be doing? And what that list was, I've got QuickBooks, I've got, budgeting, I've got marketing, I've got, payroll. These are things, all of those things. And I put them in a list and I'm like, can a single person do all of those things for me? Yes. And then what else is frustrating me during the day? Well, I can't follow and make sure that the staff is doing what they need to do. The flow is not going as well as I need it to. So at that point, I needed to add in another person to help me with that. And that all falls into a hospital administrator. And then I said, well, what happens when those days when my staff doesn't come in, calls in sick? I don't have an extra person. I don't have anybody that's cross-trained enough that can do their own job plus another job, and we can still function. So it got to a point where I realized that I was more and more stressed out every day. And I think that's where you have to ask yourself, can I, even if it's that I have to take a little bit of a pay cut maybe at the beginning, is this something that's going to allow me to be able to see more patients? Can I, even if your cost is so high to get a hospital administrator, can I increase the cost of treatments? The cost that the clients are paying you are in order for you to pay for, the cost of all your employees, the cost of running a facility. That has to be inside, intermixed within that cost. And what I did was I looked at it and I said, yes, I can. And I was pushed by several of my friends for months before I ever made that next step to get that hospital administrator. And they were like, you're exhausted, you're tired, you're not functioning well. Your brain doesn't work well when you're exhausted. I was looking at QuickBooks going, I don't even know how do I even do this? And then someone fell into my life who is, she's got, a master's in hospital administration, and she wanted to get out of the human field. And she was like, I'm willing to take a pay cut to come and see you and to be with you and to help you, because I like animals and I need a change. And so I was very fortunate to find her. She fell into my lap. It was not something I was looking for. And I think, in fact, if I would have looked for her or someone like her, I may not have found what I needed, because I was looking for something different, somebody that may have had veterinary experience. But I honestly feel like the field we're in right now, it's so different than regular veterinary hospitals. It's not run like a regular veterinary hospital. You need somebody that knows just how to, be able to flow a rehab center. And that may be challenging to find. So I even was looking at the physio world, I was looking at, the human PT side of things. Can I get somebody in from there, that's maybe tired of working? And anyway, so I ended up finding my hospital administrator, and she's really made a huge difference for me. And the biggest thing too is on the floor. My staff has someone they can go to while I'm in rooms to be able to deal with the conflicts, because nothing happens 100% perfectly every single day. You've got to have some conflict resolution on the floor every single day as well.
Yeah, I mean, one of the other things that is a problem is sometimes people think, like, I'm really busy now, and they get scared. They think to themselves, if I hire somebody else to help me, what happens if suddenly I don't get enough clients and then I can't afford to pay them? But every single time in my practice, when I've been in that situation when I'm going to step up, and even in online pet health now, when I've said to myself, okay, like, I need to pass this over to somebody else, every single time it has been fine, and there's been more clients. And every single other vet rehabber that I've mentored or coached, they've been in that situation, and I just say to them, when you sort of open yourself up and you actually have more time and you're in this kind of space where you can cope with more patients, they just come. That's what happens.
They do.
They just come. And then you just get more full. And then you think, okay, we need somebody else. And you make a space for somebody else. And then they just come. That's what happens. As you're growing, you just grow. So it's so hard. And I know, because I also used to think, I remember just every time I hired somebody new, I was just so nervous. I used to think like, oh, please, just don't let things suddenly get quieter, or I hope I can afford to pay everyone and pay my overheads. But it just works out, doesn't it?
It does. And there's some days, yes, where it's a little quieter and you're like, you know what, I kind of actually needed this little bit of a quiet day. And then the very next day, it just gets right back to being busy again. I'm a huge proponent of like sitting back and letting things kind of go the way that they need to go for a little bit and then reevaluate. And I always start my new employees off with a 3-month, this is our trial period. And I think that's important, because during that 3 months, you can say, did I really need this person? Are they sitting around more than they need to sit around? Do we work together? Do they like working for me? I'm a very intense person. I work, and I expect, the same work ethic from my employees as well. If we don't mix, then you've got 90 days. We reevaluate at 90 days. If it doesn't work, it doesn't work. But that gives them that trial period where they can say, all right, I'm done. I don't like this. This is not working for me. And I think it gives you some security to say, did I really need this employee or not? And then you're not kind of set in there and guaranteed for that. And of course, I think there's labor laws that you have to look into for whatever your state is or your country is. But for me, the 90-day kind of after 3 months, I'm like, I got this. All right, this person is great. This fits well. Or no, this person absolutely does not fit. And so it gives me a chance to reevaluate.
Yeah, so one of the things that I learned, and it took me a while, so I had a few people that didn't really fit. And you keep them on and you just keep thinking, well, let me just keep changing the systems, or like something will make this work, because you've got them there now and you spend all that time training them, and you think like, well, like, we're just going to make this work. Like, there must be, maybe it's me, maybe it's just, we can sort this out. And what I learned is to actually look at core values. So, and this took me a long time, but when I did realize it, and I sat down and I wrote like, what are my own personal core values? And what are my core values now for my practice? Then when I had those core values, and whether it's like, we work ethically, we work with integrity, we always put the patient first or the client first, whatever your core values are, and in a certain way, I like, one of mine is like, we work hard, like, I am a really hard worker, and so that's really important to me. And like, the patients and the clients like would come first, and so that was really important for me, is that it didn't matter whether, whatever that the patient needed, and if it was better to refer the patient to the pool that was down the road, that's what we did, because that was more important, so that was one of my core values. And so I realized after a while, once I developed those, then I looked at like people that I'd previously had, maybe that I had employed, or people that I currently had at that time. This is why we're not working out. This is why they're not working out with me, because our core values are not aligned. There is something about their core values and how they practice or how they hold
Mm-hmm.
themselves that doesn't align with me, and it doesn't sit well with me, and that's why we're clashing. And so when you realize that and you sit down and you write your core values, then you start to say like, okay, like that's when you start to hire people that actually work with you and fit with you. But you know, sometimes, like you say, like sometimes we don't know all that. We don't know this. So you hire people and then you have them for ages and ages and ages, and you just keep struggling on. So to those vet rehabbers listening, that's what I would suggest that you do. Like sit down and say like, what is important to you? And then when you write all those core values down, and you can even Google like core values of companies to get some ideas. Like on Google, they've got loads of lists of things, and you can just like iron out maybe 4 or 5 what's important to you, and then you can even discuss it with your team. And you know, I can remember talking with my team, and I remember there was one team member that wasn't aligned, and they were not happy with the core values, and the reason is because it wasn't aligned with them. And that person actually eventually just sort of said, okay, I'm sort of going to leave now, you know, because they suddenly realized like, I don't fit in here, like this is not me. So another one of the challenges is dealing with people, and the more people you have, the more challenging it becomes for everyone to get on. So like when it's just you, it's a lot easier. Then you have one person, then you can deal with those people, and then as you start adding in the rehab team. So how do you manage all those different personalities? So like, what is your procedure and process to like keep everyone happy and not fighting? And
well, it's been a road to figure that out. I will say that. I think a big part of it was, and I realized this when about a year ago, is that I laid a basic rule down that there's no gossiping about anyone. If I hear gossiping, if I hear someone putting another team member down, it's cut off. You know, if it continues, you're gone for the day. Like we'll move on without you, because I don't like that mentality of we're going to talk bad about this person, we're going to gang up on this person. I've seen it happen too many times in veterinary clinics with, you know, techs just squabbling amongst each other. And so I kind of put that basic rule right there, and I listen, and my hospital administrator listens. So that basically right there says, okay, people can't just talk bad about each other. The other thing that we did was we actually play a game where we look through the Chinese personalities. So your constitution, are you an earth personality? Are you a metal personality? You know, those of you who are you know, trained in Chinese veterinary medicine will understand this, but there's a whole questionnaire, and there's one by the Chi Institute here in Florida that they put out that you can do it with your dog patients. And I just had my staff members do it as they were like, if they were a dog, you know, and fill out so that they could figure out, you know, maybe 2 elements that they kind of aligned with. And we went around the room and we talked about it, because depending on your constitution depends on how you deal with stress. You know, do you bottle that up and then eventually explode? Do you hide out and then, you know, cry about it at home? Are you openly tearful about it? Or do you need more positive reinforcement than, say, some other people? And so by doing that, we learned a little bit about each one of our team members. I learned that one of my team members just really thrives on positive reinforcement. Another team member really doesn't want people to be, you know, maybe in her business and you know, doesn't really want people to ask more details about them. Doing that exercise also helped us for them to understand how to deal with dogs in the exam room, because understanding like if a dog needs more space than, you know, maybe another dog wants to be up in your face. So that was actually kind of a twofold exercise, and I thought it was really good so that people kind of understand each other. And my biggest thing is that as I tell people, I said, I need you to support each other. I need you to work as a team. You have a list of tasks that you need to get done for the day, but if you finish your task list, that doesn't mean you're done and you go home. That means you help your team members so that everyone can get home at a decent hour, so that nobody feels like they're drowning. And then what I did was I actually cross-trained a lot of different staff members, so that those things that, you know, we have a stance analyzer, and sometimes that takes 2 people. Sometimes one person can do it. I train my receptionist so she can pop back there and help the assistant if they need help, so that she knows exactly what she's doing. So that everybody feels like they are an equal part of the team. If you start feeling like there is a hierarchy, one team member is more important than another team member, then you start creating jealousy amongst everyone. Jealousy creates strife, conflict, and those are ways that if we can kind of make everybody feel equal, on an equal playing field, then I think that's important. But also having those opportunities for them to not do necessarily just work together. So we just have fun, like Friday lunches where we just maybe play a team building game, or we just sit there and chat, or we talk about, maybe we had a week full of, dogs passing away. We talk about grief. And so I think those moments are very important as well, because you have to build that team together. You can't have people just working and never building up and never enjoying each other's personalities or getting to know each other. So I do think that those fun little times where you're not talking about work are very important as well.
Yeah, there was a practice when I went to visit the States in Denver, and they used to, every Friday, they used to come really early, and somebody used to come and do Pilates in their exercise room together. So all of them, used to do Pilates together, and also great. It might have even been twice a week. So they actually they employed somebody to come, and anyone could come if they wanted to.
Yeah.
So I love that obviously, the team, because that's so important. And like one of the things I remember, in my practice, as well as other practices that I worked, there were a few of them where everyone would leave together. So not one person leaves before the others. I mean, sometimes it has to happen because somebody has to go fetch a kid or whatever. So sometimes it has to happen. But majority of the times, in my practice, before I had very young kids, we all used to leave together. And that really helped with the team stuff, because, we're not leaving until somebody has finished cleaning the treadmill or whatever. Then people jump in. And especially when you talk about that hierarchy, like one of the things that some people hate doing was answering the telephone. And we used to say that everyone and, anyone answer the telephone. If the telephone rings, like it's 4 rings and you've got to answer it. And, I used to answer the telephone. If I was there, I would answer it, pass it over to somebody, but at least I answered it, and cleaning or whatever. Do you know what I mean? We do. You have to all just come together and do everything, and it really helps when you, as the vet, is doing all that stuff too, then it really, it sets an example for everybody else, and that hierarchy thing, I think, is a problem, because in veterinary, not that I ever used to do it. So I used to, I'm a qualified vet nurse as well as a vet. So I'd actually locumed as a vet nurse. So I think my vet nursing always used to just come in. So like, I remember setting up for anesthetics, and the nurses saying, "What are you doing? You're a vet. You don't do that," But, in a lot of veterinary practices, the vets will just stand, and they'll call somebody, "Can you clean that up?" And that's a problem, because then you have all those issues, don't you?
Yeah. Well, I think it's too, like the people that get into that physio, though, were a little bit more hands-on anyway. And so, I also was that person. I was like, "Oh, you need help putting that catheter in? Okay, let me help you do that. You need somebody to clean this cage. All right, let me take care of that." And they're like, "Don't you have other things?" I'm like, "Yeah, but you guys are like swamped, like, let me help you out." I am the person that goes and cleans the mats before, if we're just trying to get patients in the rooms, I'll vacuum and everything. But if you feel like you are over your staff and they are there to, be your servants, then I think you're going to have an issue and more strife in your team. Finding that respect, asking them. And this is the other thing that I also started doing, is saying, do you have the resources that you need to do your job? Are you feeling like overwhelmed because you can't speak up to tell me that you need more, or that you can't do this by yourself? And some people can't ask for help. It's just not something they're able to do. And so for me to ask, do you have the resources, before I get frustrated that their job is not being completed the way I need to stop and say, am I giving you what you need? And usually I'm not. Usually if there's a frustration, it's because they either have too much on their plate and they can't handle it, or they need an additional person to help them. And if I do that, then I'm asking for their input, which I think is very important and also builds a team, because a team doesn't just have a leader and followers. The followers are giving the feedback as well. So I think that's an important thing to note as well, as far as building up a team morale, that they have the ability to ask for help when they need it too.
Yeah, I mean, they should feel safe. They should be
Mm-hmm.
safe in their word, that they're not, that if there's a problem, but it depends on personalities, obviously. But that makes me think about systems. So, that's something I often tell vet rehabbers, they need to get systems into place. And, when we start off, it's just us and we know how to do everything and we do everything. And then you get somebody else, but it's okay. You can just tell them directly when they do something wrong. You say to them, no, and it's just the two of you. And as you start to get more people in, then there are more people to be able to manage. And then things start to fall to pieces often because you don't have systems in place. And so, I mean, one of the things that I learned is that when you hire somebody, all right, and they've got certain tasks, it's really important that you have documented an operations manual on how to do their job. And I used to get frustrated because it was something that I would be doing every day. And I think to myself, well, it's quite easy to do. Like it's not a difficult task. But remember, this person's come into something very new, and this is the first time that they've done it. And I would show them once how to do it, and then I'd show them they wouldn't get it right. Then I'd have to come there and show them again and show them again and show them again. They're just not getting it, because most of the time they're getting flustered because there's either a client waiting, and so when I'm actually showing them now for the fourth time, they're not properly listening. And then I would just get so frustrated, and I think to myself, I'm just going to do it myself. And then you start to think to yourself, why did I even employ this person? Because I'm just doing all this on myself. I should have just kept doing it myself. It's so much easier than having to do it again when they've done it. And then I realized it was actually my own fault, because I didn't have this operations manual. So once I got that, then things were so much easier when I hired somebody, It was so clear exactly for them. And then they would go through the operation. If they had to ask a question, then they did, but it was usually once. And then they were like, okay, I got it. And they just follow the operations manual. And often if you take too long to put the systems into place in the operations manual, then you get so big that it's like, where do we have time now to sit and document everything? So I've got a lot of vet rehabbers that I mentor now that are in that position. They're like, it's a work in progress. I'm getting there, but we just don't have the time because we're so busy. So if you guys are listening and you're starting out, like, this is important. So, like, write down everything that you do and write a procedure and update it, because it changes all the time. That's the other thing. It's a work in progress, And like you say, if you have a team and you get together and you say, this is not working, then you change the system, and then you got to document it again. It is work, but it's important to make sure that things and operations run smoothly.
And I think when I first started, I tried to be like, I'm just going to write everybody's job out and do it straight away. That was a little harder for me, I think. But once I got kind of the systems in place of how we did it, then what I did was I actually asked the staff to give me their feedback. I said, can you write down every single thing that you do? And then a small little description of how you do it. And some people were like, well, how do I describe how I clean the floor? And I'm like, well, it's just write this, and then you're good. But I asked the staff to help me with that, because I don't do their jobs anymore, exactly the way that they do them. And it doesn't start really hitting you until you have a staff member like, okay, I've got to move on to a new job. And you go, oh crap, now I don't know how to train the new person that was there. So what I do, I had a really great staff member that moved on to another job, and I was like, okay, the last week you're here, I want you to write every single thing down. By the end of it, it was 3 pages long of what she was completing. And I was like, okay, well, now we actually have some place to go, and I can actually see how detailed your job really is. And we wrote every single one of those things down into a list, so that we had that ready for the next person. The next person came in, it was much easier to train her, because I was like, these are all the things that you need to accomplish, and these are all the things that you need to do. So it made it a lot easier. I think having that list for some of my team members too, because they're like, did I do this? Did I do that? They like a list. They like checking off things. I mean, a lot of our brains are like that. Not everybody enjoys a list, but it's kind of there's like relief when you do check a box off, So I do provide lists for all the team members that we have. But that came from years of one employee doing a job, writing it down for us. And then we kind of perfected it a little bit, so that we were able to, be able to train the next person without too much, hand holding basically through it, that they could read through those notes and figure it out.
And where it's also nice is when you have somebody that's sick, then somebody else has to do their job, and they might know how to do it, but then they just can't remember, and then at least they've got a whole document, and they can say they just follow it list by list, exactly, point by point, and they just know that they're doing it correctly, and then they don't have to ask somebody else, because that's also the problem, is that we're in the consult room with the patient going from one room to another. When somebody then stops us and says, how do you do this? That's not a quick thing to be able to tell them. No. And everyone's with patients generally. It's really helps.
Yeah, absolutely.
Lisa, thank you so much. I think it's been awesome. I think the vet rehabbers are really, really going to enjoy everything that we've said here, and I think that that's really going to help them. So vet rehabbers, if you have any questions about growing your team, please, you can reach out to me anytime. Some doggy barking in the background there. No worries.
Yeah, sorry.
I'm happy to help you guys. You can email me at meg@onlinepethealth.com. And Lisa, thanks so much. We're going to be doing some more training with Lisa. She's going to be helping us with a few of the business basics on the members platform. So really looking forward to that, Lisa. And thanks so much for your time. Really appreciate it.
Absolutely. Thanks for having me, Megan.
Cheers, Lisa. Bye.
Vet Rehabbers, for more information on how to take your career to the next level, go to www.onlinepethealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.